Cooperative Extension Service, University of Maryland System presents Using Pesticides Safely, a 6-part training series for registered technicians. Program 3 examines how pesticides can get on and into your body and how to avoid this. You'll see poor work habits that can lead to unnecessary pesticide contamination. We'll show you 3 ways pesticides can enter your body and the 3 main effects pesticides can cause. You'll see the protective equipment required for certain types of applications, and you'll learn procedures to follow in case of an accident.
Like aspirin or prescription medicines, pesticides can be helpful at the right dosage, at the right time. But like medicines, they can harm us when they're misused. It's dosage that makes the difference between a remedy and a poison. Less poisonous pesticides can be more dangerous because sometimes we don't handle them carefully and we're exposed to them more often. Let's turn to the medical profession for more about how we get exposed to pesticides.
Before a pesticide can make you sick, it has to get into your body. This can happen in 3 ways. 1, breathing the vapors, or inhalation exposure. 2, eating or drinking the pesticide, or oral exposure. And 3, through the eyes or skin, dermal exposure. Our lungs absorb gases and vapors quickly, so if pesticide vapors are in the air you breathe, pesticides will get into your body. That's why respirators and masks are so important. Now, oral exposure. You're probably saying, there's no way I would eat or drink a pesticide. But oral exposure can happen on the job through careless work practices like these, all guaranteed to put some pesticides into your system. But the greatest risk for most applicators is from skin exposure. Usually the pesticide gets on your hands or feet because of sloppy practices, from spills, during mixing, from touching treated surfaces, or just surfacing equipment. And pesticides can pass through your skin into your body, so getting a pesticide on your skin can lead to serious poisoning or even death. Your eyes absorb pesticides very, very quickly. Some pesticides will damage your eyes in just a few seconds. And just like skin exposure, eye exposure can lead to poisoning. Let's look at what happens when you're exposed to too much of a pesticide. There's little hazard to this applicator while wearing a face shield, gloves, and protective clothing, as recommended on the label. But this applicator is asking for trouble. He could splash concentrate into his eyes or spill it on his unprotected hands. Both are mixing the same pesticide, so the toxicity is the same. What's different is the higher exposure and greater risk for this applicator. There are 3 main kinds of effects pesticides can cause: acute effects, chronic effects, and sensitivity. Acute effects occur from a single, usually heavy exposure to a pesticide. Acute means severe. It happens quickly, often in minutes. Symptoms of acute poisoning can range from feeling tired, headachy, dizzy, sweaty, that sort of thing, to blurred vision, pinpoint pupils, cramps, throwing up, to unmistakable poisoning symptoms, such as being unable to breathe, severe confusion, or coma. It all depends on the particular pesticide and the amount of exposure. Chronic toxicity comes from many small exposures to a pesticide over a period of time. Eventually, serious effects such as liver, lung, or kidney damage, nervous system problems, tumors, or birth defects might occur. The likelihood of chronic effects depends on the particular pesticide and your exposure. Finally, their sensitivity. Pesticides can irritate the skin, either because they are just naturally irritating or because you become sensitive or allergic to the chemicals over a period of time. Some pesticides can severely irritate the skin only after exposure to sunlight. This is called photosensitivity. Other allergic reactions are similar to hay fever, such as sniffling and watery eyes.
Now let's look at how you can protect yourself from exposure to the pesticides you work with. One of the easiest ways to protect yourself is to wear the right clothing. The kind of application you're doing and the pesticide you're using determine what protective clothing and equipment you'll need. At the very least, you should always wear a long-sleeve shirt, long pants, and shoes and socks. And don't wear any leather items like belts or work boots because they soak up pesticides. You need to check the label of each pesticide you use for specific requirements. Respirators keep you from breathing in pesticides. Cartridge respirators are the most common. They usually cover the nose and mouth and have filters to absorb toxic chemicals. Some respirators are disposable. Wear them the recommended number of hours and then replace the entire mask. Others have replaceable filters or cartridges. Canister respirators cover the entire face and protect your eyes, nose, and mouth. Self-contained breathing apparatuses, or SCBAs, have their own air supply and are commonly used when fumigating. Every type of respirator or breathing apparatus must fit properly. If it doesn't, it's worse than useless because it will give you a false sense of security. You'll need eye protection whenever you're mixing a concentrate or working in a mist or dust, or whenever the pesticide has an eye warning on the label. Use tight-fitting, non-fogging goggles or a full face shield. Whenever gloves are required, you should choose neoprene or rubber gloves, unless the label states otherwise. If you're spraying at a level below your waist, your shirt sleeves should come down over the gloves rather than being tucked inside, so that any spills on your arms won't run down inside the gloves. But if you're applying a pesticide over your head, tuck your sleeves inside your gloves or tape the gloves to your sleeves. Sometimes your work will require other types of protective clothing. Rubber or neoprene boots protect your feet from spills and while walking through sprayed areas. A rubber or neoprene apron protects your chest, waist, and legs from splashes during mixing. Repellent coveralls protect you from your wrists to your ankles. Hats or hoods protect your scalp and forehead from pesticide spray drifting downward. The label will tell you the minimum amount of protective gear you need, but use common sense too. Don't take chances with your health. If you think you need more protection, wear it. And remember to wash your hands. Wash them before eating, drinking, smoking, or using the bathroom. No matter how careful you are, you'll always pick up a little residue on your fingers or the back of your hands. And take a shower or a bath as soon as you get home. Make it a habit to wear a clean set of clothes every day. Be sure to keep your work clothes separate from your other clothes and to wash them separately. This will keep the household laundry from becoming contaminated. Use a heavy-duty detergent. Set the machine for large load and use hot water. Pre-wash products may help remove small spills, but if you spilled a highly toxic concentrate, a product with danger poison on the label, you're better off just getting rid of those clothes. If you spill pesticide on your clothes, immediately take them off, quickly. Don't worry about indecent exposure. Just get those contaminated clothes off your skin. Then wash the contaminated area, first with plain, then with soapy water. Call for help. Call a doctor or a poison control center. It's up to you to make quick decisions based on the situation. If you splash some in your eye, flush it with clean water for 15 minutes. Then follow any other label directions. And of course, follow the first aid instructions on the label. And in all cases, keep the label for the medical people so they know how to treat the poisoning. Hopefully, you'll never have to handle a situation like that. However, if you do, keep calm and keep that label nearby. To sum it all up, remember, your risk depends on the toxicity of the chemical and your exposure to it. While all pesticides are considered toxic to some degree, not all pesticides can cause all of the effects we've described in this program. And the amount of protective clothing and gear you'll need may be more or less than that shown in this program, depending on the chemical, the type of application, and whether you're mixing and loading a concentrate or just applying diluted material. Check the label and ask your supervisor for more specific information about the products you use. After watching this program, you should be able to answer a few key questions. The written answers to the questions are included in the video program package. If you can't answer them correctly, review this program. Ready? Here goes. 1. What are the 3 ways pesticides can get into your body? 2. Tell me 5 possible symptoms of acute poisoning. 3. How could chronic effects occur? 4. What is sensitivity to pesticides? 5. Tell me 3 things you can do to reduce any risks from the pesticides you use.